Easter holidays are just over a week away, and many are planning visits with their loved ones, but there is talk of a possible third wave of COVID-19 infections after the holidays. Let's speak to Professor of Vaccinology at WITS, Shabi Mati, on whether tightening lockdown regulations over this period would help. Professor, very good morning to you. What are we looking at now? What are our expectations for this period?
Good morning, Jane. So all indications are that, in fact, in 6 of the 9 provinces, there's already the beginning of an increase in number of cases compared to 2 to 3 weeks ago, which is already worrisome. And I think the main issue is not one of going into lockdown, but rather restricting mass gatherings. What we do understand in terms of the transmission of the virus is that more than 80% of infections are either directly or indirectly related to mass gatherings, and especially mass gatherings in poorly ventilated indoor spaces. So I don't think South Africa needs to go to a level 3 lockdown in its totality, but it needs to be much more targeted. And what we really need to be looking at is restricting mass gatherings.
All right. So what would help alleviate the third wave or the fourth or the fifth, or, is to get a better vaccine rollout. What's the problem there? Why is it still so slow?
Absolutely. And it's not about vaccinating 40 million of the population, because that is not going to happen anytime soon, and not during the course of 2021. There needs to be a very targeted approach. When facing a resurgence, what we really need to be concentrating on is trying to prevent people from being hospitalized or reduce the risk of being hospitalized, as well as to reduce the risk of individuals from dying from COVID. And the way to do that is to target high-risk individuals. Unfortunately, it seems that the vaccine program in South Africa is all over the show. As an example, we now have in the process of exporting 1 million doses of vaccine, the AstraZeneca vaccine, which the WHO recommends still be used in countries where there's a high prevalence of the B.1.351 variant. And we're exporting this vaccine to other African countries, which are probably also affected by the B.1.351 variant. In the meantime, we're waiting for 20 million doses of Pfizer vaccine, which we simply don't know how that's going to perform against mild or moderate infection. All of these vaccines, including the AstraZeneca vaccine, are very likely to protect against severe disease. So it's really befuddling to the mind as to why we're doing what we're doing in terms of exporting vaccine rather than actually providing an opportunity to those individuals that are at high risk of dying of COVID-19 or of being hospitalized, being vaccinated with the AstraZeneca vaccine. So unfortunately, there doesn't seem to be a coherent policy right now.
No, and I mean, so we were told that no money was wasted in bringing the AstraZeneca vaccine. I mean, that is quite frankly not true. The amount of money spent on bringing in and storing it. And this latest research coming from a US clinical trial shows that AstraZeneca is 79% effective. I mean, what a waste of vaccines that we had here on our doorstep.
Yes, and it's 100% effective against severe disease and death. And so, like I said, it just boggles the mind in terms of what the strategy is when we're actually exporting vaccine, when the rest of the world, including all other African countries, are clamoring to get hold of whichever vaccine they're able to get hold of, because we know that all of these vaccines are probably going to perform equally well, at least reduce the risk of developing severe disease by 80% or greater.
Okay, so I want to know from you what needs to change to improve our vaccine rollout. And you wonder how many people have to die before we bring in the private sector who, I mean, many of them, Discovery, for example, just one of the examples, are ready to take it on.
The challenge that South Africa faces is that if we don't have a coherent vaccine strategy, we're simply not going to be able to compete for the limited quantities of vaccine that does exist. So what we need to focus on is getting our hands on whichever vaccine has been shown to be effective, and then basically trying to get as much of that vaccine into the country and targeting it not to a random person and not to the tiers that they've basically mapped out in the past. That is sort of redundant in the context of the variant that's circulating in South Africa. We need to be focused on ensuring that we get high-risk individuals vaccinated as quickly as possible. We already, like I said, probably starting with the beginning of a third wave. And unfortunately, by now, it's probably too late to prevent what's going to occur during the course of the next wave.